Our family was impacted 3 different times in a 10-month period of time by medical harm. And my father-in-law, myself, and our son each got infections, healthcare-associated infections. And our son, Joshua, died from his infection.
In my own case, this came home to me about 10 years ago when my mother died. She was a very vigorous 80-year-old woman who died because of 3 preventable medical errors that occurred.
My mother wound up in the hospital, and she spent weeks there with what turned out to be a pretty serious infection, bloodstream infection. But she was in the hospital for a long time, much longer, weeks longer than she should have been.
It has been a little over a decade since the Institute of Medicine put out its report To Err Is Human, calling for a national program to address patient safety. And we have made steady progress since then, but it's been slow. And what excites me about Partnership for Patients is that we now have the kind of federal leadership and resources that we need to make really dramatic improvements in patient safety, in particular readmissions and healthcare-acquired conditions.
When you leave a hospital and you're in a very confused and vulnerable state, you're given a set of instructions, discharge instructions, about what to do. And the things are very simple in a way, but the 5-minute session that the nurse gives you on the discharge instructions really aren't enough time for you to ask questions or absorb this kind of thing.
There's an awful lot of suffering, even if someone doesn't die from a medical error or unintended readmission to the hospital. They may suffer for weeks with some infection, or they may be in the hospital much longer, which is traumatic for anybody, but also very hard on the family.
It's important to recognize that when errors occur and patients are injured, it also results in additional health care costs in most instances.
What we have to do is change how care is delivered in a fundamental way so that safety happens. It isn't something we sort of add on. It just is a result of the way we do things.
We have a slogan. We say, all teach, all learn. The idea is that out there in the healthcare system, there are people who know and learn things that they could use to help their peers. Now they're the best possible teachers. So the second wave is going to benefit from the learnings of the first wave. All teach, all learn. And at this rate, we're going to affect the whole country.
Well, the aims are to reduce harm from hospitals and hospital care by 40% and to reduce 30-day all-cause hospital readmissions by 20%. Those aims are incredibly important because they are things that we should already be doing. To me, those aims are kind of low-hanging fruit. While the goals seem high, and they are transformational if we achieve them, because they're going to save $35 billion, which is 9 zeros, which is an incredible amount of money that can be used for other things, rather than be wasted and spent on things that we could prevent.
The status quo is no longer where we are. We're moving off the status quo. We've left that town, and we're moving into a new town. It begins with a partnership for patients. It begins by fostering and leveraging the patient-physician relationship we've had in new ways.
The patient does have to play a major role in his or her own care. The problem is that most patients not only don't understand that, they don't want to do it. They want to be able to turn themselves over because they don't feel like they know enough. And it's a scary thought to think that the man or woman who's in front of you that you're entrusting your life to needs you to make decisions. So you think, wait a minute, you're the doctor. Why do you want me to make the decision?
Patients really are an integral member of the care team. And patients and their family caregivers actually deliver a sizable amount of healthcare services. So patients need to understand their treatment plan and be comfortable with that. They also need to be able to carry out that treatment plan and comply with it.
Everybody is a partner with you, including your physician. Their vested interest is in seeing patients stay well and get well. So for a chronic patient, it's wonderful.
It's no longer acceptable to just put your life into my hands. You've got to understand what I'm doing and all the decisions, because not all of them are equal. They all differ, and all of us differ as patients.
They talk to you. They teach you. They want you to learn. They want you to be part of the choices.
If we do this right, patients will live and they won't die. If we do this right, people will come out of the hospital better than they went in. I think that with this collaborative, we have a very, very great chance of making great efforts and making great progress in the culture of safety here in America, and we must.
We think the partnership can put this on the front burner so that caregivers on the front lines know they're not alone when they talk about quality and safety, that this is something being supported from the very top, that it's supported at the very top of the government, that it's supported at the very top of their hospital by the CEO, that there's a very visible commitment.
When you're looking at trying to lower the opportunity for people to get harmed in a hospital setting, how can you be against that? When you're looking at trying to prevent hospital readmissions, that's what we all need to be doing as a nation. And I think the Partnership for Patients really pulls together all of the national organizations and community organizations to really be behind a campaign that will make life safer.
This is the beginning of the new medicine. People get rewards when they stay well. Rewards of feeling better than they have in years, or whatever it is. That you finally comply with something and you go, oh my, I didn't know I could feel that decent.
We're leaders in the healthcare business on behalf of our patients. So we have to inspire everybody that we deal with to improve. It's about improvement. It's not about measurement. It's not about pointing fingers. It's not all about accountability. It's inspiring quality and realizing we have to improve.
Far too often, far too many patients, we fall short of that high standard. This is not just about improving health, but by reducing medical errors, we're also going to bring down rising health insurance costs, which have put a growing burden on families, businesses, and government. By assembling this partnership and committing to these ambitious goals, we're sending a clear message that we can no longer accept a healthcare system in which only some Americans get the best possible care. We know that the type of change we're talking about today won't come easily, and we also know that it can be done.